The aging of America is quite evident. Every day in the U.S., another 6,000 people reach the age of 65. And while our nation's older adults now number about 36 million, that figure is expected to double by the year 2030. That poses a serious health issue that should concern us all.
As we increase in age and we increase in the number of medical conditions and medications we're taking, the potential for adverse effects or side effects doesn't mean it's necessarily going to happen, but the potential for it happening does increase.
Medications are probably the single most important factor in improving the quality of life for older Americans. But that also means our nation's seniors are especially at risk for medication-related problems.
Well, the problem is that physicians are prescribing more medications for people, and a lot of that has to do with managed care, that they have less time to spend with them, and so they tend to send them out of the door with a prescription. So people are on more and more medications. And because of that, we can have more and more drug interactions, and we can have adverse drug reactions, and they can range anything from being sleepy, having a little fatigue, all the way to death.
Modern medicine works wonders for millions of Americans every day, but inappropriate medication use can erode their life-enhancing benefits and even create other problems, especially in older people and others taking multiple medications.
So I think a lot of the seniors, they just take the medication and sometimes they forget to take it, or sometimes they're putting too many in at the same time.
There's a fragmentation, unfortunately, in healthcare where many seniors are seeing multiple providers, primary care, heart doctors, foot doctors, you name it. There's multiple providers caring for our older individuals. And with that becomes prescribing of multiple medications. And it places a lot of burden on that patient to understand all those medications, how they interact.
This is where a consultant or senior care pharmacist can help our aging population. As a true patient advocate, a senior care pharmacist has a solid understanding of diseases that affect older adults to ensure that patients' medications are appropriate, the most effective, and used correctly.
And that's one of the things I love about the job. I've always considered myself to be a patient advocate, but it's very difficult to be a patient advocate when you're just filling a prescription off of a piece of paper. And that happens in a hospital setting as well as in a regular pharmacy setting.
When I came to see Linda, I think I was taking 13 or 14 prescriptions, and I had 9 or 10 physicians and surgeons. She pointed out some drug interactions. Surprisingly, a lot of them were moderate. And she also combined two. Says you don't need these two separate medicines because there is one medicine now that will cover it, and it will cost you much less money.
Well, we have this mantra that any new symptom in an older individual should be considered a drug side effect until proven otherwise. And this is really important because as we increase in age, our ability to react to medications change because of the way we eliminate them and metabolize them, which puts us at greater risk for side effects as well as drug interactions.
Whether it's talking to seniors about health awareness, providing health maintenance, or evaluating a particular patient's medications, the senior care pharmacist is today helping our nation's seniors in a variety of environments, including assisted living facilities, hospitals, senior centers, and home and community-based care.
She helps our seniors understand about their medications, about various interactions between medications. She promotes good health by encouraging exercise and good nutrition, and she explains things like heart disease, shingles, which a lot of our people have had trouble with over this last year, and diabetes and things like that, so that I've always said that people leave here smarter than when they came in whenever Nikki's here.
She's really good about getting subjects that we would like to talk about. We've talked about medication interaction, and if we have a problem, we can go to her and she'll try to help us with it.
The aging of the baby boomer generation is resulting in people living longer and taking more medications. The senior care pharmacist will play an invaluable role in helping make this longer life a healthy life by ensuring that older adults receive the most appropriate, effective, and safest medication possible. The rapid growth of America's senior population has compelled a broad rethinking of how the U.S. delivers health care. Older Americans consume nearly 1/3 of all prescriptions in the United States, and their inappropriate use can be deadly.
What we're seeing on a public health concern is with this increase in medication use, sometimes again appropriate by the patient or inappropriate because they don't take them regularly or they take them when they think they need them, which is another public health concern, can lead to hospitalizations, emergency room visits, increased visits to the doctor's office, and unfortunately can potentially lead to death.
Consultant and senior care pharmacists are healthcare professionals who have been specially trained to coordinate medication therapy for the well-being of our nation's seniors. They are essentially patient advocates for today's aging baby boomers.
For me, it was very exciting to be in a position where you could actually look at a person's whole medication regimen and what's happening with them and actually try to determine what can be done to affect change, to do something positive for the patient. So that's where being a patient advocate really comes in.
The American Society of Consultant Pharmacists represents specialists across the country who are dedicated to senior care, identifying and preventing medication-related problems through a careful evaluation and monitoring of patients' drug regimens. You'll find senior care pharmacists wherever seniors reside and anywhere there's a need for high-level medication management.
If I have to take anything over the counter, I must ask about what effect will it be with the drugs I'm taking, and I'm taking plenty.
You don't just go and grab something off the shelf. You read it to make sure it's not going to interact with what you're already taking.
Senior care pharmacists are about more than just managing medications. They're dedicated to helping people live better and longer lives.
Medications, if used appropriately, are very good. They can improve our quality of life, decrease disease state burden, and ultimately let us live a healthier, longer, stronger life. The role of the senior care pharmacist is to help you better manage those medications to potentially avoid any negative adverse consequences or side effects from your medications.
There's going to be a much larger percentage of elderly individuals within the population who are on a lot of medications, who are going to remain independent as long as they can, who are going to need help managing all of that, and senior care pharmacists are there to help them do that, and the need for them is just growing and growing at an incredible rate.